So again, welcome everyone. This is the E2i Intervention Exposure Tool for the Behavioral Health Intervention Focus Area sites. Before we get started on the content of the training, I'd love to hear who is on the call. So if you could please say your name when we state the site, that would be great. So is there any, who is here from Consejo de Salud, Puerto Rico?
So you pick mostly female? It got to be female. Oh, got to be female.
If there's anyone from Consejo de Salud, Puerto Rico, you can go ahead and unmute your mic and say hello, or you can use the chat window. Okay. Who is here from Greater Lawrence Family Health Center?
Hi, this is Amy Bositis from Greater Lawrence Family Health Center.
Welcome.
Thank you.
Hi, this is Ryan Dono from Greater Lawrence Family Health Center.
Okay, great. And who is here from the Health Emergency Lifeline Programs, also known as HELP?
Hi, my name is Abby. I'm here from HELP.
Great.
And there should be more people coming in here and there. They're on their way.
Okay, great. Okay, who is here from La Clínica del Pueblo? Okay, do we have anyone from Oklahoma State University?
Yes, we're here from Oklahoma State University in Tulsa, Oklahoma. This is Dr. Ladd.
Lisa Jenkins.
And this is Erica Quick.
And Angela Bloxham.
Okay. Who is on the line from Our Lady of the Lake Hospital?
Hi, this is Asia Day.
Hi, this is Keisha Holiday.
Welcome. Who is here from North Jersey Community Research Initiative?
Hi, my name is Tiffany.
Hi, Henry Walla. That's it.
Great, welcome. And then who is here from the Poverello Center? Okay, thank you everyone for those introductions. We will go ahead and get started on the presentation. So again, just as a quick reminder for anyone who's just joined, if you could please mute your mic when you're not speaking. And during the course of the presentation, we will be pausing for questions, at which point you can unmute your mic, or you can use the chat window that's part of Zoom. You should be able to see a chat emblem probably on the bottom of your screen if you'd like to submit questions that way. So as an outline today, we're going to briefly go over the enrollment tool, and then the main focus of this webinar is going to be on the intervention exposure tool. We're going to do an overview of the tool, and then we'll be going over the specific intervention exposure tool versions for each of the interventions. So that will be BUP, COCM, and SBIRT. And then towards the end of this presentation, we'll be going over some examples of how to use these forms in practice. And as I mentioned, we'll be pausing for questions throughout the training. So just as a quick introduction, again, of our Evaluation Center team, I think many of you have seen this introduction a couple of times. the main people I'd like to point out on the call today, we have Beth Bordeaux, who is both our project coordinator, and she's also the site liaison for the behavioral health intervention focus area. We also have Starlee Shade, who is our quantitative evaluator on the call today. And then myself, I'm Mary Gouze, I'm the data manager and the analyst for the Evaluation Center. And so when you're contacting the Evaluation Center, most likely you'll be interacting with Beth because she is your site liaison, but I'll also be answering a lot of the questions that you may have surrounding data collection. But if there's any questions that you have for the Evaluation Center overall, we'll make sure that those questions get triaged to whoever is going to be an expert in that area. You can submit your questions to the E2i Evaluation Center at ucsf.edu email address, and Beth and I both monitor that email address regularly, so we will make sure that your questions get answered as quickly as possible. I'd just like to pause here. Beth, is there anything you would like to add or say now at the beginning of this presentation?
No, just I send my greetings to everyone, and I'm looking forward to working with you on this project. So, welcome.
Thank you, everybody. Thank you, Beth. So we'll now be going over the data collection tools. So the first item is the participant enrollment tool, and this form is going to be collected whenever a participant enrolls in the E2i intervention. And this tool is going to be filled by the frontline staff, and at this time, at the time of enrollment, you'll be assigning a participant ID. Your data managers will be providing lists to the frontline staff of the participant IDs that are available to use, and so you'll be assigning those at the time of enrollment. Once you've completed the exposure tool, Beth, could you jump back just real quick? Thank you. Once you've completed the enrollment tool, you're going to give it to the data manager. This will be completed on paper, and you'll provide it to the data manager, and the data manager will be entering this tool into the E2i data portal as soon as possible. So now we'll go through the individual elements on the intervention enrollment tool. The first item that you'll provide is your organization. You'll also then assign the participant ID. We'd like you to provide the date of enrollment into the E2i intervention and the date the person started services at your organization. In some cases, the date of enrollment into E2i may be the same date that the person is starting services at your organization, and that's fine. We just need to have both of those dates filled, even if they're the same date in those two spaces. And all dates are going to be in the 2-digit month, 2-digit day, and 4-digit year format. We'll also be collecting participant demographic information, the first of which is year of birth, which will be a 4-digit year. And then we'll ask for sex at birth, current gender, Hispanic, Latino ethnicity, and race. And race is a check all that apply variable, so you can select as many of these response options under race as needed for the client. And I do want to state that the response options that we provided here in the demographics on this tool, these response options are the HRSA standard response options for these variables. We need to be able to compare all of the E2i evaluation data to the rest of the HRSA data, which is why we need to use these response options. So now, are there any questions about the intervention enrollment tool before I move on to the next item? Okay, great. So we will, okay. So now we'll go over the intervention exposure tool. So the intervention exposure tool is going to be collected by frontline staff contemporaneously with their interaction with the patient or the client. And this means that the frontline staff will need to be filling out this tool at the time of or immediately after their interaction with the client when they're conducting activities with the client. And each service provider who's going to be conducting E2i intervention activities on a given day will fill a separate tool. in order to provide information on the activities that they conducted with the client in their particular time period. So examples of this are that on the first day that a client comes to your organization and interacts with the intervention, perhaps a lay staff person, they're going to conduct a screening with the client. And then after that screening's finished, a clinician, separate from the lay staff person, does a counseling session with the client. And so because in this case, the lay staff person has done a screening, and that's one chunk of time with the client, and that's one activity, that lay staff person is going to fill one tool, one intervention exposure tool. The clinician, because they've conducted a separate activity with the client at a separate time period, even though it's on the same day, they're also going to fill a separate tool. So on this day, because there's two different clinicians providing two different activities in two different chunks of time with the client, we're going to have two forms for the client at the end of that day. The second time that the client interacts with the intervention, they meet with a lay staff person, and at that time period, the lay staff person does both an assessment with the client and also does some case management activities with the client. Because this lay staff person has conducted both of these activities in one chunk of time with the client, we only need one form, one tool from the lay staff person to be filled out. And the tool does allow you to select more than one activity. So but I hope that provides a little more information on how those tools get filled. And then a little later on, we're going to be doing some examples of how you use these tools. And so there may be some examples that may answer some questions you may have, but I'm happy to take any questions you have now. Okay, so we'll move on to data submission of the intervention exposure tool. So your data manager and your site leadership are going to provide more information to you on where and how to submit the completed tools at your site. There's going to be two different methods that the frontline staff may use in order to submit data. The first is that for some sites, they may be able to use a web-based data collection tool, which means that the lay staff, the E2i staff people who are providing the intervention activities to the clients, they may not need to use a paper tool for the intervention exposure tool. Instead, they will fill it out on a web-based tool directly, and then that will be directly submitted to the E2i data portal. The other method, some sites may not be able to have the resources or the workflow that will allow for web-based data collection. So instead, those sites may use paper data collection, in which case, once those paper tools are filled, they'll be given to the data manager, and the data manager will be the one to submit the information to the E2i data portal. If you're going to be using the web-based tools at your site, your data manager will be receiving a unique link for your site from the E2i Evaluation Center that will have a site-specific form for you. So that link will be only for your site, and it will have your specific intervention exposure tool version with it. And so this link will be provided when your site's ready to begin data entry, and the data managers will be able to provide training to the frontline staff on how to use these web-based tools, and also they'll make sure that access to the link is maintained. Are there any questions about the methods now before we move on to the content of the intervention exposure tool? Feel free to send questions through chat, or you can unmute your mic to ask questions. Okay, so we will have some examples of methods of filling the forms a little later in the presentation, and we'll also be pausing questions again. So if any questions come up throughout the presentation, feel free to ask them when we pause again. So the intervention exposure tool, we're only collecting information that's needed for the multi-site evaluation. And so this means that we're not collecting a lot of patient details on the tool. Instead, we're collecting information about the activities that were conducted, and really more broadly looking at the when, the who, the how, the what happened, and for how long. So when we walk through the tools, you'll see how we're collecting this information. So each intervention, as I mentioned, is going to have a customized intervention exposure tool, and some elements are going to be the same for all the interventions. This will be things like the participant information section of the tool, the date of encounter, and the service provider sections. And then other elements are going to be formatted specific to your intervention. And so we'll go over each of those custom elements in a few moments. But now we'll go over the common elements through all of the tools. So the first is we'll ask you for the organization. We'll ask you to enter the participant's ID, that ID that was assigned at enrollment, the participant's year of birth, their sex at birth, and the current gender. And some of these variables, as you'll probably have noticed, are the same as what we're collecting on the enrollment tool. And the reason we're collecting them again is because we need to be able to have a few variables that we can use for data quality cross-checks. And also, one example of this is if, for example, a participant ID that we receive in an intervention exposure tool doesn't match to an ID that we saw in the enrollment tools, we can use some of these extra variables to do some cross-checks to try and narrow down who this tool may belong to. It's important for us to be able to make sure that data is consistent, so please make sure that your participant IDs that you're using those carefully, but we are also collecting this extra information for data quality purposes. So now we get into the common elements of the intervention encounter details on the tool. So we'll ask for the date of the encounter, and again, all dates are entered in the 2-digit month, 2-digit day, and 4-digit year format. And then we'll ask you to provide information on the service provider. So this is a check all that apply variable. And what that means is that you can select as many of the roles that that person fills, that provider is filling in your clinic. So if, for example, if the person happens to be a peer or a member of your target community, and they're also a mental or behavioral health staff member, you can tick both of those boxes. Another example of this is that if two providers are providing the same activity to clients at the same time, so for example, if there was a health educator and a social worker who were both conducting care management with the client at the same time in the same session, you would be able to tick both the lay staff and the mental and behavioral health staff boxes here. With this tool, we just need to know the roles of the person or the people who are providing that particular set of activities at that particular time. We don't need to know specifically the number of people. We just need to know the roles. And so the other, sorry, can you just jump back? Thank you. So the other thing I want to mention here is that there are examples under each of the response options here. So for example, under prescribing provider, we have MD, PA or physician's assistant, and nurse practitioner. Non-prescribing providers, we have registered nurses, LVNs or LPNs, and medical assistants. Mental and behavioral health staff would be people like social workers, therapists, substance abuse counselors, and lay staff is anyone who is non-clinical. So those may be people who are care coordinators or managers, services specialists, health educators, or outreach workers. And I would like to say that these examples are not intended to be comprehensive. They're just there to give you an idea of the kinds of staff members that we're talking about for each of these response options. It's very possible that you may be using slightly different job titles or may have some additional roles at your site that fit under some of these response options. If you have any questions or want to clarify what a certain role is, please let us know. But hopefully these examples will give you an idea of the types of roles we're looking for under each of these items. Okay. So now we'll go through the BUP tool. So we'll ask you to provide the modality of activity. So that is the type of interaction that you had with the client for that session or encounter. So was it an individual? Was it a group interaction? Did you contact them by phone or through text message? And then you may also be contacting them online depending on the protocol for your intervention. And online is really something like email or a Facebook message or any kind of social media contact. I'm not sure if this is the case for BUP, but if there are group sessions that you're having with clients, and this applies actually to all interventions, if there are group sessions happening in your intervention, each person who is involved in the group session needs to have their own tool filled. Okay. So next in the BUP tool, we'll ask you to indicate the intervention phase that that session is related to. So is it the induction, the stabilization, or the maintenance phase? Next. And then we'll ask you to tell us what the activities were for that encounter with the client. And again, this is a check all that apply variable, so you can select as many of these as apply for that interaction with the client, with that provider at that given time. So in this case, we have intake and screening and assessment, counseling and clinical visit. If you select the screening and assessment option, we would like you to let us know which screening and assessment type was done in that visit. So was it a substance use disorder, withdrawal, or a toxicology screening or assessment? Once you fill out the activities, the next item will be outputs and outcomes. And so this actually tells us the status of the person at the end of that intervention encounter. And so this tool is only filled for people who screen into the intervention. So if this is an initial screening visit, we want you to indicate that they're appropriate for the intervention. And then you'll want to select any of the other relevant options that are listed here based on what occurred during the encounter. So the other options here, if the person receives any referrals, you use the referred for additional services. If they've, at that visit, that they've completed the intervention phase that you indicated previously, so that induction, stabilization, or maintenance phase, if they've completed it, we want you to tick the intervention phase completed. There's also care and treatment plan developed, continue intervention, which would indicate that the client would be expected to be returning to the intervention again for another session or encounter. We also want to know if the medication was prescribed or administered. And in this case, depending on your intervention, we know that clients may not necessarily have the drug be administered to them where they're taking it in front of you, but we'd like you to tick this whether they've taken it or they've just been prescribed it. Starlee, would you like to go ahead?
Sure. I just wanted to clarify that if this is a screening visit and you define somebody as appropriate for the intervention and refer them for the intervention, then we would want you to tick the referred for additional services box.
Thank you for that clarification, Starlee. So then the other last options here are transition to primary care and then intervention completed discontinued. And if you select intervention completed discontinued, we want to know the reason that they completed or discontinued. So the options here are that they completed all the sessions according to the protocol, or if they didn't complete all the sessions according to the protocol, but they've achieved remission or they no longer need the intervention, you can select that option. And then we also have options for if the provider decides to discontinue the participant before they've completed the intervention, or if the patient themselves decides to discontinue. So please pick one of those options if they've completed or discontinued. And then the last item on the tool will be duration in minutes. So how long did this session take with the client? And please always use minutes for this element. So for example, if the person has a session that goes for an hour and 5 minutes, please enter 65 minutes. Are there any questions about the BUP tool? These are draft versions of the tool, and so if you have concerns or questions about some of the options that we've provided as it relates to your intervention, we are open to discussion about making edits to make sure that it fits to what your plans are for your implementation.
Hi, this is Amy from Greater Lawrence. Can I ask a couple questions?
Of course.
First, let me just start at the bottom with duration in minutes. For the BUP, if this is a clinical visit, are you looking for the amount of time that the staff were actually providing care to the patient, or the entire time the patient was there from beginning to end?
We would like to know the amount of time that you spend doing the intervention activities with the client. Okay. So in this case, I think it's probably more related to the amount of time they spent in doing care with the client rather than time there with the clinic.
Okay. And then my second question is, can patients be enrolled and then intervention completed, and then can they be re-enrolled? Because with buprenorphine, patients often go on and off. for various reasons, can we continue to re-enroll? Using the same ID number, not a new ID, but.
Yeah, we actually, excuse me, I've been talking a lot this week. We would like to consistently use the same ID for clients, so long as you are sure that it's the same person, which in your case, I'm sure you would. So I think that I'm going to let Starlee jump in here in a moment if she'd like to clarify any of this, but I do understand that you may believe that somebody's completed an intervention, but then they come back again. And so it's fine for you to continue to add intervention exposure tools for the person, even if you initially indicated that they completed or that they discontinued.
Right, discontinued.
We will be able to track that in our data system by the mere fact that we're going to have more forms come in for them, even after maybe one has said that they've completed or discontinued. So we'll be able to see that in and out.
Okay.
Starlee, is there anything you'd like to add?
Sure, just to clarify. So the answer is yes. We definitely want to, if the person re-enrolls, we want to use that same number and follow them. Due to the limited time frame of the initiative, we will only be following folks for a year for the purposes of the cross-site evaluation. However, if for the purpose of your own evaluation, you would like to continue to capture that information, we will include it and send it back to you, but it won't be included in our evaluation. Does that make sense?
Yes, it does. Okay, those are all my questions. Thank you.
Great, thank you. Thank you, Starlee, as well. Are there any other questions about the BUP tool, about the use of it or the content of it? Feel free to use the chat window as well if you're unable to use the audio.
Hi. Hello?
Hello.
Hi, Mary. I wanted to know for number 11, where it says duration in minutes in parentheses, is there a time frame of how long you're supposed to meet with a client? Like, is there a cutoff time?
In terms of entry of the form, I've allowed you to enter up to like 500 minutes. So, I mean, no, not really in terms of what you enter into the form, but I think that will somewhat depend. The limit may more depend on what your particular implementation looks like. But in terms of how much time you can enter into the tool, I've allowed for there to be an upper limit of time. I don't know if it's quite 500 because that would probably be impossible. But I have made sure that there is a big window so that if you ended up spending several hours with a client for some reason, you'd be able to enter that into the tool. But again, we only want to know the amount of time that you're spending doing intervention activities with them.
Okay.
Great.
Thank you.
Of course. So let's see, there is a question that came through the chat window here. Can you clarify the 1-year measurement period? Does that mean we won't always complete the enrollment and intervention implementation encounter tool throughout the 3 years of the intervention? No, so the 1-year measurement period just means we only follow clients for 1 year. So each client, you can collect, when you're collecting information for clients, when we receive that data at the E2i Evaluation Center for our particular analysis, we will only be following a particular client for a 1-year time period. However, as Starlee mentioned, you can continue to enter information for that client after 1 year if you will be continuing to follow them, and we'll be able to send you that data if you want to look at the data yourself. Because of the way the initiative is set up, you'll probably be enrolling clients over the course of that 3-year period. So you'll be filling out these enrollment and intervention exposure tools throughout the entire initiative. We'll just only take information for each client for 1 year for our particular analysis. I hope that clarifies things. Okay, so then there's another question here. If a patient is discussed during a psych review meeting, do we complete a form or only when there is a direct interaction with the client? You'll only be completing this intervention exposure tool when you have a direct interaction with the client. So if they're being discussed during a psych review meeting internally within your organization, you do not need a tool for that. But if you have a phone call with the client, or you are sending text messages to them for reminders, or meeting with them in person or in some kind of group setting, then we need a tool for them in that case. Are there any other questions about the BUP tool? Okay, I think we'll move on to the next section then. However, I will mention that we will be pausing for questions again towards the end. So if you have other BUP questions that you've thought of, we will have time to address those later in the webinar. Okay, so now we'll go over the COCM tool.
Sorry, Mary. We have
yes, go
just
ahead.
one question, Mary, before you proceed.
Yes.
Will we get an updated and or revised form for the enrollment and intervention information encounter tool?
Yes, so prior to this presentation last week, I sent the versions that we're viewing in these slides were sent to your data manager, but those are, again, just draft versions. So next week, we are planning to send out the final versions to all of the behavioral health intervention sites towards the end of next week. We wanted to make sure that they're in a draft form only right now, so that if any discussion during this webinar came up and we identified any need for changes, we'd be able to make those changes, but you will be receiving those next week.
Okay, thank you.
And we'll be sending all of these tools to your data managers for them to distribute to your site. So the COCM tool, there'll also be a modality of activity question here. So please select the one that is relevant for your interaction with the client. I think for COCM, most likely that's going to be individual, but depending on how adaptations have occurred for your particular intervention implementation, there may also be some phone, text message, or online interaction with the client. And again, online is things like email or social media contact. So activities for COCM, we have intake, screening, and assessment, and counseling. If you select the counseling option, please indicate the type of counseling that was conducted with that client for that session. The other thing I'd like to mention too is that screening and assessment, and this applies both for COCM and all of the interventions, is that screening and assessment is not just for the initial screening and assessments. If you do any kind of assessments with the client throughout the intervention, you can use this item. And then we also have a reminder item. And again, this is a check all that apply. So you select all of the options that apply to the client. And then again, for counseling, we just want to know the type of counseling that was done.
And you always do motivation.
So then we have the outputs and outcomes. This is again also a check all that apply. So we want to know if the client, after the initial screening, if they were appropriate for the intervention. We'd like to know if they were referred for additional services. If you developed a care and treatment plan for the client, and if they're going to be continuing the intervention, so if they're planning to come back for additional sessions, please use that option. And then in the case of COCM, we know that there may be changes made to the client's plan for the intervention, so in terms of the different kinds of counseling that they might be getting. So if you make an adjustment to their plan, please use that option. If any medications are prescribed or administered, please let us know that. And then we also have the intervention completed and discontinued option. If you select this option, let us know the reason the person completed or discontinued. And then finally, we have, again, duration in minutes. So please fill in the number of minutes that you spent with the client for that session. Oops, I apologize. I need to update the title of that slide. I'll do that before the slides go out to everybody. All right, are there any questions about the COCM tool? Feel free to unmute yourself or to use the chat window if you have any questions about the tool.
Hello, Mary.
Hello.
What does COCM stand for?
So COCM is another one of the behavioral health interventions.
Okay, gotcha.
So we're now in the section of the presentation that is specific to each of the different interventions in this focus area.
Gotcha. Thank you.
Of course.
Sure. It stands for Collaborative Care Management, which you may have seen in some of the earlier materials referred to as IMPACT.
All right.
Thank you, Beth. If there's no questions about COCM, we'll go ahead and move on to the next item. And just as a reminder, if you are not speaking, please mute your mic so that everyone can hear clearly. So now we'll go over the SBIRT tool. And Beth, can you share the SBIRT, what the SBIRT stands for, please? The acronym.
Sorry.
It's okay.
I apologize to everyone. I'm advancing the slides because we've had some technical difficulties earlier, so I'm juggling a handful of things here. I apologize for.
No, it's totally fine. I appreciate your help with this.
So it's for screening, brief intervention, and referral.
Thank you. There's a lot of acronyms in these in the E2i initiative, and I'm still learning them, so I often will ask for help with them just so that I don't misquote. So, okay, we'll go on to the next slide. So I want to give some additional information about the SBIRT tool. So SBIRT is unique from a lot of the other interventions in E2i in that clients are going to be receiving all of the intervention activities at the time they enroll. And so because of this, we streamlined the process for the SBIRT site so that the enrollment tool and the intervention exposure tool have all been combined into one form, because we know that really in this intervention, clients are going to come in, they're going to enroll, they're going to receive the intervention, and they're not going to really be having contact with the intervention again afterwards. So we've streamlined everything into one tool. And so if you're a paper-based site, everything's going to be on one tool on paper. And then if your site chooses to use the web-based data entry, we've also created a combined tool there so frontline staff can fill all of it out at once. The SBIRT tool is going to be filled and submitted for all clients screened for SBIRT that are eligible for E2i. And so E2i eligible means that they're HIV positive clients. And SBIRT, if you are choosing to enroll, I'm sorry, if you please mute your mic if you're not speaking. Thank you. So we do know that there are some sites who are doing SBIRT that they're going to be screening clients who are not HIV positive, and that's okay. They're welcome to use these tools and fill them for those clients, but we ask that you only submit the tools to the E2i data portal if they are for HIV positive clients. Okay, so now we'll walk through the SBIRT tool. If we could jump back one slide. So this is just a repeat of the enrollment information that you've seen earlier in this presentation, but I'm just putting it up here because it is a combined tool for SBIRT. So the SBIRT tool is going to have all of these elements on it. But we'll go ahead and jump forward to the intervention encounter details. So again, we have the date of encounter and the service provider, which is, we discussed these earlier in the presentation. But in this case, just as a reminder, that date of encounter is going to be the same as your enrollment date for SBIRT. We'll ask you to choose the modality of activity, and I believe in most cases for SBIRT, it's going to be individual, but go ahead and just choose, when you fill this tool, just choose the modality of that interaction that you've had with the client. And then for activities conducted, we have screening and assessment. And really all the clients who are having all of the clients who are part of ESPERT are going to be getting screening and assessment. And then if the client does receive counseling as part of the intervention, we'd like to know what kinds. So there's the brief negotiated interview, and then there's also the reinforced positive behavior or REACT. And check all of these that apply for that interaction with the client. And then for outputs and outcomes, again, anybody who's receiving this intervention, they're going to be appropriate for the intervention. And then if they are referred for additional services, so in the case of ESPERT, for people who are high risk, they're referred. So we want to tick that box in those situations. And then finally, if all of the activities with the client were completed for ESPERT according to their different, what the screening showed for them and the different things that they qualified for as part of ESPERT, indicate that their intervention was completed. And then finally, we want to know their duration. So how long did the session take with the client? Are there any questions about the ESPERT tool? Feel free to use the chat window or to unmute your mic if you have any questions. Okay, so we'll go ahead and move into the examples of the tool usage. And we will again be pausing for questions throughout this. So this first example is for sites that are using paper-only tools. So the frontline staff will only be using paper. And this specific example I have used is based on BUP interventions, but I will say both for this example and all of the other examples we're using, these are just intended to provide you with some examples of how a workflow may look at an organization, but these examples, they might not reflect the specific workflow at your site. We're just hoping these examples give you a sense of when and how to use these tools. So in this example, an E2i nurse practitioner enrolls the client in the intervention, conducts the intake and intervention screening activities with the client during a clinical visit. And then after that interaction with the E2i nurse practitioner is completed, the client sees, as part of the intervention, a substance abuse counselor and receives some counseling. And at the end of that counseling session, the substance abuse counselor develops a plan with the client and schedules a time for them to come back to the clinic to initiate their treatment. So in this example, I do want this to be somewhat interactive. So I'll be asking some questions, and feel free to unmute your mic or to answer in the chat window. So the next steps, the first question is, which forms are filled during this client's first encounter with the intervention? So again, the nurse practitioner enrolled the client and conducted intake and screening activities during the clinical visit. And then a substance abuse counselor provided some counseling to the client as part of the intervention. So which tools are filled? Okay, in this case, we're going to have an enrollment tool and an intervention exposure tool filled. So then as a follow-up question to this, how in this particular example, based on the information we discussed earlier in this presentation, how many intervention exposure tools are going to be filled and by whom? Okay, so in this particular example, we're going to have two tools. We're going to have one from the E2i nurse practitioner for the intake and screening activities that occurred. And we're also going to have one from the substance abuse counselor for the counseling activities. And the reason why we have these two different tools is because the nurse practitioner provided two activities to the client in a particular time span in that day. And then separately, the client saw the substance abuse counselor for that counseling activity in a second space of time. And so we need we have two service providers with two different activities or sets of activities in two distinct time periods in that day. And so we need two tools. Okay, so now we'll walk through the filling of these forms. So we'll walk through the filling of an enrollment tool. So we'll be using University of San Francisco, California, San Francisco as our example site. We've assigned the participant ID on this enrollment tool, fill in the date of the enrollment. And this particular client, they were started to be seen at the organization a few months prior to their enrollment in E2i. So that is indicated here. We fill in their year of birth. And then we indicate their demographic variables. So now we'll walk through the nurse practitioner's tool for the services that they provided with the client or the activities they provided. So we'll fill in the participant information, the top here. And then they enter the date of the encounter. They enter, so this is a nurse practitioner, so they're a prescribing provider.
Excuse me.
Yes.
Hi, it's Belen talking from La Clínica del Pueblo.
Yes.
When you go back on the demographic, last time when I was in the training, I mentioned that there wasn't a spot for Latinos or Hispanics.
If you go back, can we go back one tool? We do have a Hispanic Latino ethnicity item.
I can't see it from where I'm seeing it.
Okay, well, the enrollment tool has a question for Hispanic Latino ethnicity. That's a yes or no question. And then we have a separate race question that's all that applies. So we will be able to collect information on Hispanic Latino ethnicity.
So, but for the number 9, I'm sorry, I'm pretty confused. I know that if it says Hispanic or Latino, I press yes. Then on the race question, which of those do I apply if it's not applicable to any of my patients?
So what's important is that you ask this question of the participant, but unfortunately this is how HRSA collects this information. So you may want to correspond with the folks in your clinic to see how they fill this out for the RSR and just use that approach as well. I mean, we recognize that many people don't characterize themselves as, as any of these categories, but unfortunately, these are the categories that HRSA has used, and so we have to stick with it.
Okay, I will ask my team leader. Thank you.
Thank you for your question. Okay. Okay, so this is the nurse practitioner's tool, so they'll select prescribing provider. So in the modality of the activity, this was an individual interaction and it was initial stages. So we've got the induction phase of the BUP intervention. This is a BUP intervention example. In the activities, the nurse practitioner did intake and did a screening assessment. And in this case, they did a substance use disorder assessment with the client. And then there was also conducting a clinical visit with the client. So in the outputs and outcomes for the nurse practitioner, they're going to indicate they're appropriate for the intervention, and then they are going to be continuing the intervention. And then the duration is 25 minutes. That's how long they spent with the client conducting these activities. So in the next item, so now the client is also seeing the substance abuse counselor. So that person is going to fill a separate tool for those activities with the client. So all the same information at the top of the tool. And then for the intervention encounter details, same date, and then the service provider was a mental and behavioral health staff because they were a substance abuse counselor. And the modality was individual, and they're still in the induction phase. The activities were counseling, just counseling, so there's only one tick there. And then for outputs and outcomes, if you recall from the example, they developed a care and treatment plan, and then the client's going to be coming back to initiate their treatment. So we've indicated continue intervention, but they didn't have any medication prescribed that day, so we don't tick that there. And then the duration for that session with the client was 30 minutes. So that is all of the tools that are filled in that particular example. So next steps here. This is a paper-based site, so all the tools are filled on paper. So the first question is, who is the enrollment form given to once it's completed? Okay, in this case, because it's a paper-based site, the data manager is going to be given the completed paper tool, and the data manager is going to be submitting it electronically. And I do see that that answer did come in on the chat window, so thank you very much for that. I'll try and give a longer pause for the next question. So then the next question is, these intervention exposure tools were also filled on paper, so who are those tools given to? And I realize this may look like a trick question, but I promise that it is not.
The data manager?
Yes, that's correct. Because this is a paper-based site, all tools that are filled on paper by the frontline staff are going to be given to the data manager, and the data manager will submit them electronically to our data portal. Okay, so now we're going to go through an example of frontline staff who use web-based data collection tools. And so this example is for a COCM site. So a client comes in and the E2i outreach worker enrolls the client into the intervention on September 1st, 2018. And after enrolling the client, the outreach worker schedules the client for a counseling session. And that's all the interaction that occurred during that first day. So at this first encounter with the participant, the enrollment tool is filled because the client was enrolled. And so because this is a web-based site, but what do you do with, given what we discussed about the enrollment tool early in the presentation, what do you do with the enrollment tool after it's been completed? Okay, in the we're going to give the enrollment tool to the data manager for electronic entry. If you recall, the enrollment tool needs to be filled on paper for everyone, and then it's going to be submitted to the data manager. And that allows the data manager to start tracking the IDs that have been assigned and start entering and tracking the patients. So that is why we're doing that. All enrollment tools are done on paper and given to the data manager. And then the next question is, do we need an intervention exposure tool at the time of the enrollment for this interaction? Okay, the answer here is, so there was a response in the chat window for a yes, and actually in this particular example, there doesn't need to be a intervention exposure tool because the client was only enrolled in intervention. They didn't actually have any intervention activities for COCM conducted. The client was just enrolled and then told to come back to have the intervention activities, to have that counseling session. So in this particular case, because no intervention activities are actually conducted with the client at this time, they don't need that intervention exposure tool. And again, depending on what your adaptation looks like at your particular site, this may or may not be the case. There may be some sites where as soon as someone is enrolled, they're going to be receiving intervention activities. But there may be some sites where maybe a client is just enrolled and then they're going to be contacted later for those intervention activities. So it really just depends on your implementation plans and your adaptation. We're just hoping to give you a sense of when these tools are filled. And this is just to emphasize that you only need the intervention exposure tool if you're actually conducting intervention activities with the client. But thank you for your response in the chat window. I do hope that this is more of an interactive section of the presentation. So to extend the example, a few days later, the client comes back in and the E2i therapist meets with the client for their first therapy session and conducts intervention intake and assessment activities with the client. And then the E2i therapist conducts motivational interviewing counseling session with the client. And once that counseling is over, at the end of the session, the therapist refers the client for some additional services. They develop a care plan for the client, and then they schedule the client for their next session. So this is a web-based data entry tool site. So web-based data entry means web-based entry for the intervention exposure tool. So who enters the data into the web-based tools? So the person who's going to be entering these tools is actually going to be the, oops, there's a typo here. This is going to be the E2i therapist. I know this says health educator, but I'll update that before the slides go out. So there'll be the E2i therapist because the therapist is the one who was conducting the activities with the client during that encounter. So then the next question is, when do the forms get entered? When does the E2i therapist need to enter them? So you could go ahead and pop that back up we want to have all of these intervention exposure tools, whether they're paper or they're web-based, they need to be filled during or immediately after the session with the client is completed. We need to have these tools filled as real time as possible because the further you get away from interaction with the clients, less likely we are to be able to capture complete information of what happened. So again, all of these tools, whether web-based or paper-based, need to be filled during or immediately after any activities are conducted with the client.
Mary, can I jump in for a second?
Yes. Mm-hmm.
In looking at the chat box, there was a comment about clients completing forms, and I just want to make a note of that because for this initiative, we're not asking clients to complete any forms whatsoever for the evaluation. So these will always be E2i staff, either your data manager or your frontline staff, that will be documenting your activities, but the client is never going to fill anything out that will be sent to us.
Thank you, Beth. Okay, so for this web-based intervention exposure tool entry, again, the data managers are going to be providing links to the frontline staff who will be doing data entry in this manner. And this is an example of what the link will kind of look like, and it's going to be specific to your site. And so because of the nature of these links and how long they are and the coding we have them in them to make them specific to your site, we have discussed with your data manager that a shortcut or a bookmark of some kind will be set up on the computer or tablets being used by the frontline staff so you can easily access these web-based data entry tools. So there's a thing in the chat window that says who enters the data tool. I thought it was the data manager. So there's going to be different methods of data entry depending on what your site decides to do. So you can either have the frontline staff who are interacting with the client, you have the option of having them just do paper tools, and then the data manager would enter all of that tool information into the E2i data portal. That's one option. The second option for sites who have the resources or a workflow that will allow it can set up a method of having the frontline staff fill the tools only online and not have to have any paper tools. But that really depends on what's going to be best for your site, both for your logistics in terms of resources and workflow, and also perhaps the workload of your frontline staff and your data managers. So if you need help deciding which method might be best for your site, please let us know. Please email us at E2i Evaluation Center at ucsf.edu. We're more than happy to have a discussion with you about what method you'd like to use. We also have provided an in-depth data training for the data managers a little earlier this month on those 2 different methods. So your data managers should have some additional information on that. But we can discuss it further with you one-on-one if you want help deciding which to use. I'm just going to walk through an example of what these web-based tools look like if your site chooses to use that option for the frontline staff. When you open the link, there will be a message at the top of the tool with these instructions. So it's really, really important that when you're filling these tools, you do not close the form or the browser window or the tab that the tool is open in before you complete the form and receive a confirmation message your data has been successfully submitted. So once you have finished submission and you've hit the last submit button, you'll get a confirmation message that all of your data has made it to the data portal. If you close the form or the browser or the tab before you get this confirmation message, we cannot guarantee that your data has been saved. So it's really important that you complete the forms in full and then submit them and confirm that they've been received before you close anything. So the web-based tools, they look a lot like the paper tools that we've walked through already. Your organization is going to be pre-selected for you because the links that you're being provided are going to be coded for your site specifically. So your organization will be selected already. We're using La Clínica del Pueblo as the example site here. Just for this example, you fill the participant ID, the year of birth, sex at birth, and the current gender. This is the participant information section of the tool. You'll click the submit button, and then you'll be taken to the intervention exposure details section of the tool. You'll enter the date of the encounter, and you can use the today button. There's a button there that says today on it. If you click that, it will automatically fill whatever today's date is. And in most cases, because these tools are going to be filled in real time or immediately after the interaction with the client, that today button is going to probably be the easiest way for you to enter the date. But if for whatever reason you have to enter information that was entered on a different date, you can type in the date with the 2-digit month, -2-digit day, -4-digit year, or you'll see a little calendar button there. You can click that and a little calendar widget will pop up and you can select the date. But again, today, that today button is probably going to be the best option because of when you'll be entering this information. You'll also indicate the service provider. In this case, it was an E2i therapist. So you can select that item. The modality of activity was individual because of the counseling session. In here, they did the intake and the initial screening and assessment for COCM, and then they did a counseling session. And when you click counseling, that's when the counseling type will become available to you. Until you click counseling, those particular items won't be available to you, but once you click it, they'll pop up and you can select the item. And so in this case, it was a motivational interviewing in this example. And then you have your outputs and outcomes. So the client was appropriate for the intervention, they had a care and treatment plan developed, and then they're going to be coming back for additional sessions. The duration, they spent 60 minutes with the client. And then at the end of all of the web-based tools, we'll be asking you to re-enter the participant ID. And that's just because we want to have confirmation it's a data quality measure that all of the information that was being entered throughout the web-based tools were for the same participant. So once you click this last submit button, you'll be taken to the confirmation message that the form has successfully been submitted to the E2i data portal. And at that point, then you can close your browser window or your tab. And then you can click the link again, whatever manner in which your data manager has set it up to access that link. You can reopen it and the tool will be blank and you'll be able to enter another additional tools. So if you have another client you need to enter information for, you can reopen that link and it'll be blank and enable you to do that. And data managers will be providing more on-site training to frontline staff on using these tools and practice versions of these tools. If your site decides to go in that direction, we will be happy to provide your site with practice links for those training purposes for your frontline staff. Okay, so now we're going to walk through an SBIRT example of the combined enrollment and intervention exposure tool usage. So when the person comes in for SBIRT, go ahead. The client comes into your organization as identified for expert intervention. And so an E2i health educator initiates the expert intervention with screening phase 1. And then based on that, the client has a positive screen. The client is identified as a moderate risk user, and so they have a brief negotiated interview. And that concludes the intervention. So next steps, and when is the tool filled and by whom? Okay, in this case, the tool is going to be filled by the health educator who conducted those expert activities of the client, and they're going to be doing it during or immediately after their interaction with the client. Okay, the tool is submitted if it's a paper-based site. Then this tool is going to be filled on paper, and the data manager is going to submit it for electronic data entry. And if it's a web-based data collection site, then the E2i Health educator is going to fill the tool online and using the link that the data manager provided. So for the purposes of this example, we're just going to walk through a paper version of the tool. So again, this is a combined enrollment and intervention exposure tool. So all of this information, all the information that was on the enrollment tool is going to appear on this version of the tool. So we fill out all those items. And then it's also going to have the intervention encounter details. So the date that the encounter happened. In this case, it was an E2i health educator, so they're a lay staff, they're non-clinical staff. The modality of activity is individual. The client received the screening, and because of the results of their screening, they received the brief negotiated interview. The outputs and outcomes, they were appropriate for the intervention, and the entire intervention was completed with the client. And that session took 30 minutes. So that's an example of the full expert tool. Okay, so that concludes the examples as well as the presentation that we have for the E2i Evaluation Center. However, we do have some time left in the webinar. So if you have any questions about anything we've gone over today, whether it's about your specific intervention tools or about data submission methods in general or anything at all, please let us know. You can use the chat window or unmute yourself, and we're happy to answer any questions you have.
Hello, this is Erica Quick.
Hello.
I just want to make a comment regarding the Hispanic. Hispanic is not a race, it's an ethnicity. So the E2i person filling out the information can ask the question if the person identifies as the race as white or as descendant with Black African American.
Thank you for that input.
Thank you.
So we have a question in the chat window about when will the sites be ready to start data entry. So that's really going to depend on your site. The CCTA is in the process of meeting with all the sites about implementation plans. And so they'll be working with them to set implementation start dates. So we will make sure that when your site is ready to start your intervention, when you're ready to implement, you will get access to the real E2i data portal. Your data managers currently have access to a practice version of the portal for training purposes, but we will make sure that that real data portal becomes available. And again, next week, you'll be receiving the final versions of the tools. So those will become available to you. But really, it's going to depend on your site. We'll make sure that all of that, the data portal becomes available to you once your implementation start date is set. And again, even now, if you don't have your implementation start date, but you know the kind of data entry method you want to use, if you know that you want to use the web-based method of the tools for the frontline staff for the intervention exposure tool, please let me know, and I'm happy to provide your data managers with a practice link so that the frontline staff can start getting familiar with how those tools look and function. And the data managers, again, will be providing information and more training at your sites for that method, if that's the method your site chooses to use.
Mary, just one last question. Any idea when the system will go live?
The data portal?
The data portal, right.
So the data portal we will grant access to the real data portal to your site when your implementation start date is set. So I'm not quite sure, as again, the CCT is meeting with all the sites about your individual start dates. And so once we receive that information, we will make sure that you have access to that real data portal prior to the start of your implementation. We haven't provided access to sites yet, simply because we want to allow people time to use that practice portal, and then the live one will go up when it's needed. We want to prevent there being any accidental data entry in like the practice version versus the real one, which is why we haven't granted access to it yet.
So we will get an official notice from CCTA that we're ready to go live, because we've had all our sessions with the CCTA team. So I guess we're waiting for them to say you're ready to go.
Is there anyone on the CCTA on this call today that would like to input there? I don't want to speak for CCTA. I believe that's the case, that they'll be communicating with you, but again, I don't want to speak on their behalf. So I don't know if there's anybody on the call today, but I would follow up with CCTA if we can't get an answer with you now.
No problem, that's great.
But we also at the Evaluation Center, once it goes live for you, we will certainly be notifying your data manager and your data teams of when that access has gone live and what it'll look like.
Okay.
And I'm getting a message in the chat window here from Hannah from the CCTA that yes, you will receive notice of your start date via email. Fantastic. From the CCTA.
All right.
Yeah, as soon as the CCTA, hi, this is Beth. As soon as the CCTA gives you your start date, they'll be providing us with a list of start dates as well. Mary and I will reach out to you directly, or to your data manager directly, to make sure all of the details are in place and everyone feels ready at your site to get going prior to your start date.
Great, thank you.
Okay, are there any other questions about the tools or data submission? If you do have any questions that you think of after the webinar is over, please feel free to reach out to us at E2i Evaluation Center at ucsf.edu, and your site, Beth and I will be happy to answer any questions you have or triage them to others on the Evaluation Center team to get their expertise if needed. So we are always here for you as a resource for any evaluation related issues. This webinar is being recorded, and I will be providing a copy of the recording to everyone who is invited to this webinar on Monday. So you will be able to share this recording with others at your site who may not have been able to attend today in person. We'll also send you a copy of the slides so that you can share them internally with your team as well if needed. And again, please feel free to reach out to us if you have any other questions. I will stay on the line for a few more minutes. We are scheduled to end at 10:30, but that does conclude the webinar. But again, if you have other questions, I will stay on for a little while to answer them. So thank you very much, everyone, for your time, and we look forward to working with all of you as this initiative continues.
Thank you, Mary.
Thank you, Starlee.
Thank you.
Thank you. Okay, thank you, everyone. If there's no more questions, we're going to go ahead and end the webinar. Thank you very much for your time today. And we look forward to working with all of you. I hope everyone has a good day and a good weekend.